Can caring really change patient outcomes? You know, like really change them for the better? Well, that's exactly what Dr. Gene Watson's theory of caring suggests. Now, before we dive into this idea that seems so simple yet is profound in its implications, let's meet our patient. Imagine a busy emergency department. Amidst the hustle, there's a young girl, Sarah, who's inconsolable. She's injured and scared, and her parents are trying their best to comfort her. Now, enter Nurse Ben. He's known for being efficient and focused on the facts. His priority is to stabilize Sarah quickly so she can be transferred to the pediatric ward. As he begins his assessment, he acknowledges Sarah's pain and the distress she's experiencing. But his focus remains primarily on the injury. In contrast, picture Nurse Alex, also tending to Sarah. While acknowledging the urgency of the situation, Nurse Alex takes a moment to connect with Sarah. She kneels down to be at eye level with Sarah, engaging with her and providing emotional support. She explains what will happen next and why, addressing Sarah's fears. Nurse Alex's approach not only stabilizes Sarah, but also builds a foundation of trust between them. Now, if you had to guess which nurse would be more effective in treating Sarah, you might think it's Nurse Ben, right? After all, he's the one who's more focused on the medical aspects of her care. But studies show it's likely Nurse Alex's approach that will yield better outcomes. You see, Dr. Gene Watson's theory of caring suggests that the nurse-patient relationship is crucial in healing. This isn't just about being nice or providing extra comfort measures. It's about recognizing the profound impact of compassion and connection on health outcomes. Watson's theory has several key concepts. The first is the carative factors. These are the elements of nursing care that go beyond the technical aspects. They include things like a genuine concern for the patient's well-being, a willingness to help, and an ability to understand the patient's experience from their perspective. The second concept is the transpersonal relationship. This is the unique connection that's formed between the nurse and the patient. It's based on mutual respect, empathy, and a shared journey towards healing. So how does this translate into practice? Well, consider these points. Nurses who embrace Watson's theory are attentive not just to the physical symptoms, but also to the emotional and spiritual needs of their patients. They believe that each patient is a unique individual, and that their care should reflect that. This means taking the time to listen, to ask questions, and to truly understand what the patient is going through. It's about building trust and rapport and providing emotional support as much as it is about administering medication or performing procedures. But why should we care about this? Why is Watson's theory relevant in today's healthcare landscape? The answer lies in the outcomes. Studies have shown that patients who receive care based on Watson's theory have better health outcomes, improved quality of life, and increased satisfaction with their care. Moreover, nurses who subscribe to this philosophy experience greater job satisfaction and a stronger sense of professional fulfillment. Implementing Watson's principles may not always be easy. It requires a shift in mindset and a commitment to putting the patient first. It means being present, listening actively, and providing emotional support, all of which are essential for healing. However, the benefits are immense, not just for the patients, but for the nurses and the healthcare system as a whole. In conclusion, Dr. Gene Watson's theory of caring reminds us that in the complex world of healthcare, sometimes the most important thing is simply to care. It's a call to action for nurses and healthcare professionals to embrace compassion and connection as integral parts of their practice. By doing so, they can not only improve patient outcomes, but also enrich their own professional lives and the quality of care they provide. So the next time you walk into a hospital room, remember it's not just about the medicine or the procedures. It's also about the human connection, the empathy and the care that can make all the difference.